It's a well-known fact that smoking is bad for overall health. But did you also know that smoking is harmful to cognitive health? Fortunately, some of these negative effects are reversible if you quit smoking. There are solutions to help you through it. In short, tobacco use is associated with many health issues, including an increased risk of developing various cancers such as lung cancer, but also mouth, pancreas, bladder, and so on. Other health issues include diabetes, cardiovascular diseases like heart attack or myocardial infarction, erectile dysfunction, and respiratory diseases such as chronic obstructive pulmonary disease. Smoking is a leading cause of premature death in Canada. Scientific studies also show that smokers have a higher risk of developing a neurocognitive disorder than non-smokers. According to the World Health Organization, nearly 1 in 6 cases of neurocognitive disorders are potentially attributed to tobacco use. The cardiovascular system is responsible for delivering blood to all organs, including the brain. This blood supplies all the body's cells with the oxygen and nutrients they need to function. When we smoke or breathe in secondhand smoke, the toxic substances contained in tobacco enter our cardiovascular system and interfere with its proper functioning. For example, smoking reduces the amount of oxygen in the blood. It also thickens the blood, which contributes to the formation of blood clots that can block vessels. It impacts cholesterol levels and diabetes, which promotes plaque buildup in arteries that can lead to their blockage. And it raises blood pressure, which increases the risk of ruptured blood vessels. A stroke occurs when blood flow to the brain is disrupted by a blocked or ruptured blood vessel. The brain cells in the affected areas can become damaged and die, resulting in the loss of normal function. Depending on the area of the brain involved, stroke can lead to cognitive impairment, which can include problems with memory, attention, and language. Stroke can also cause paralysis or weakness in the face, arms, or legs. A massive stroke or many successive strokes can lead to a major neurocognitive disorder. Smoking, therefore, has a closely linked effect on both cardiovascular and brain health. Remember that everything is interconnected, so taking care of one means taking care of the other. Is the damage from smoking cigarettes reversible? Yes. When you quit smoking, most of the harmful effects of tobacco fade and then disappear. Here's what happens when you put out that last cigarette. After 20 minutes, heart rate and blood pressure drop. After a few days, breathing becomes easier. Sense of taste and smell return to normal. After a few weeks to a few months, blood circulation improves, coughing and shortness of breath decrease. After a year, the risk of heart attack is halved. After 5 to 15 years, the risk of lung cancer drops significantly. The risk of heart attack and stroke are now equal to someone who never smoked. Saying goodbye to smoking increases life expectancy year after year. The brain cells also benefit, which in turn reduces the risk of developing a neurocognitive disorder. When you smoke a cigarette, the burning tobacco releases nicotine. This nicotine enters the blood through the lungs and reaches the brain in as little as 10 seconds, triggering the release of dopamine, sometimes called the pleasure molecule, which makes you feel good. This pleasurable sensation partly explains nicotine's hold on the brain, which is at the root of tobacco addiction. You therefore keep smoking to get that good feeling back. The trouble is that the brain develops a tolerance to nicotine with repeated exposure, which means increasingly higher doses are needed to achieve the same pleasurable effect. The pursuit of this effect is typically what drives consumption, thus creating a cycle that often leads to even more smoking. This cycle makes it difficult to break the habit, but the benefits are huge. It may take several attempts before you finally reach your goal of a smoke-free lifestyle. It's normal. Each attempt is a learning opportunity to understand what worked or didn't and represents another step towards success. There are many resources to help support your decision to quit and to guide you through the process. Talk to your healthcare professional for advice and support. Specialized help can greatly increase your chances of success.